This week on the BackTable Podcast.
Everything. I mean, you get better the more you do it,
Yeah.
but it is time consuming. And I kind of, if I have certain photos I want to include, I'll save them and then I'll, post them at certain times or spread them out throughout the week. But it does take time to kind of pick the picture, put the little blurb that you want. I think the hardest part is how you want to present yourself on social media.
Right.
Some
Explain
people
that. Yeah.
So some people like to have, try to create these funny posts and, kind of witty or whatnot. And some people keep it very professional.
Welcome back to the BackTable ENT Podcast. This is your host, Gopi Shah, and I have a very special guest today, Dr. Eric Cerrati, who's a board-certified facial plastic surgeon from Salt Lake City, Utah. Welcome to the show, Eric.
Hi, thank you for having me.
Thanks for being here. Eric is an assistant professor and director of facial plastics and reconstructive surgery at the University of Utah. He's also the official surgeon for the Utah Jazz, the U.S. Ski and Snowboarding Association, the U.S. Speed Skating, U.S. Bobsledding, as well as the U.S. surgeon to the International Olympic and Paralympic Medical Committees. He's also done volunteer work for medical missions for children. Before we get started, tell us a little bit about your practice, and where you're from, where you grew up, all that kind of stuff.
All right. So, like you said, I'm the director of facial plastic surgery at the University of Utah. So that's in Salt Lake City. So part of the affiliation with all those different sports teams just has to do with the location where I'm based out of. Obviously, we have a lot of extreme athletes here, with Park City, a very high percentage of Olympic athletes. And also, they had the Olympics here several years ago. I did medical school in South Carolina, which is where I'm from. I did my training in New York City at NYU, and then I did an additional fellowship in Chicago. And so I guess I continued my journey out west, and now I'm here. So I have my practice is 100% academic. I cover the full spectrum of facial plastic surgery. So I do everything from, say, like urgent, emergent, facial fracture repairs to fully cosmetic facelifts. So it's kind of the full spectrum of the field. And it, keeps me on my toes and keeps it exciting.
Yeah. So for academics and being able to have, a cosmetic practice, tell us how you develop that. Because it seems that, sometimes in academics, it may be harder to build that cosmetic practice.
Well, I can't take full credit from that. I think that the people here before me, did a lot of the legwork. So that was, kind of the structure of it was already in place. I could really take the practice in whatever direction I wanted to. And my goal was to have, 50% reconstructive or, say an insurance-based practice and 50% cosmetic. And I guess as we get further along in the podcast, you're going to ask specifically about my patient demographics. So we'll get into that.
Yeah, no, you can tell us about your patient mix. If you'd like to go ahead and do that, that's fine.
Yeah. So when I first came, obviously it was a lot of insurance based, and you're slowly building up your reputation, especially, not from Salt Lake City. I don't have any ties here. So, it's really building a reputation in the area. So the cosmetic portion has slowly become, bigger and bigger. I would say there's been a big change since the COVID shutdown. I would say before COVID, I was probably, I don't know, maybe 35% cosmetic. And then since the COVID shutdown, or since the reopening after the, the closure of all elective procedures, we've had a huge increase in cosmetic cases. And while I thought that was very rare and unusual, apparently a lot of people are experiencing that kind of across the country.
Yeah. And then, so we're talking about a little bit of your patient mix. You said with the academics, a lot of the fractures have been coming in as well as your cosmetics. Tell me about sort of some of the things or what you've used for practice building or what platforms.
So I guess before we get into that, so, facial plastics fellowships kind of, some are geared more towards reconstructive, some are geared more towards cosmetic. My fellowship was an academic fellowship, but the surgeons uh, were familiar and understood the importance of, outside marketing. And
Yeah.
so, I kind of learned a little bit through the fellowship. And so I kind of brought that, once I started this job in Salt Lake City. And facial plastic surgery is kind of unique in that, people don't necessarily, I mean, obviously having a big hospital name like the University of Utah, back you, it does provide credibility and it does bring in some patients, but, you know, particularly the cosmetic patients, sometimes
Yeah.
being affiliated with an academic center can be a negative.
Right.
And so you have to kind of, it's like a hurdle you have to deal with. I've worked with the marketing department, but the marketing for an academic center is different than marketing for, a facial plastics practice. So you have to kind of think more or less like a private practice, or, what a consumer would look for.
Right.
So for me, I have a website and I've done social media marketing, and that's, all on my own. And it is very time consuming, I would
Yeah.
say. But I tend to, kind of focus my efforts on, Facebook and Instagram. And so that's helped. And, obviously the best advertising is word of mouth, but that's just,
Yeah.
time in whatever location you're at.
I think you hit a really make an interesting point. The importance of marketing and how this is something that you found because of your fellowship. We don't really have that in our residency training and probably majority of fellowships. And I feel like when you first come out, regardless of whether you're doing facial plastics, general ENT, sinus, peds, whatever, it's hard to understand, how do you market yourself? How do you market your practice? Or the fact that you're even supposed to do that.
Yeah, totally. Doctors are classically, terrible at business.
You're right.
And when I went into med school, I was, a math major in college, which obviously does nothing for me. I wish I would have had a business degree.
I wish
uh,
we did more of that because, I was recently just talking to a recent grad and, just it's a big change and, there's probably more things we could do, such as, hey, this is how you market yourself while they're in residencies.
or even contract negotiations. I mean, I don't think I saw a physician contract until I was nearing the end of fellowship.
Yeah. No, for sure. And for me, I'm in academics as well. I was flat out told, "Hey, there's really nothing to negotiate. Like this is the standard when you're starting it out."
That's true. Well, everything's negotiable.
Right. Yeah. So, yeah, it's interesting that they tell us that kind of stuff. Do you have a fellow, Eric,
I
for
don't,
facial
but
plastic?
that's probably something I'm going to explore here in the next couple of years. It's
Okay.
adding a fellowship here.
And do your residents come to you and talk to you about sort of marketing, and do you feel like they, find you as a resource for
They
practice
do,
building?
and actually with the whole COVID restrictions,
Yeah.
a lot of residency programs are now having, they're trying to figure out how they're going to reach out and advertise the program to potential medical students who
Yep.
want to go into that particular field. And so our division of otolaryngology is now has an Instagram page. They're
Yeah.
like trying to like, ramp up social media. So it's kind of interesting. But yeah, they asked me,
I was gonna say, are you the
what,
go-to person?
I mean, yes and no.
Yeah. So for us, it's the same thing. For our residency, we, have a Twitter handle. I think most of the academic, residency programs are starting to have a Twitter program or Twitter handle, excuse me. You can see how my knowledge of social media, as well as, like you said, an Instagram. And how do we recruit, and get the word, spread the word. And so advertise your program, advertise these virtual meet and greets, so having the ability or the skill set and how to use your social media to market has, obviously been beneficial to you for your practice as well as, in other ways such as marketing a fellowship or a residency in academics as well. So it's nice to finally see some of that being used more in an academic setting.
Yeah, and I think even when I was in residency, like kind of starting out, it wasn't, a lot of people frowned upon,
Yeah.
having professional pages, and now all of a sudden it's, becoming the standard or kind of the go-to.
Mhm. Yeah. So you said Facebook as well as Instagram for your platforms for your practice. Did you have to get any like permission or anything like that from your academic center? Or is this something that you were just able to put together?
No, so I started my Instagram page probably in fellowship.
Okay.
And I guess a little bit about like each of the different platforms. So I started Instagram because it's easy. You like take a picture and you put a little, blurb about whatever it is, and then you can post it and it stays there. I never got into Snapchats and all the videos and that sort of thing.
Mm,
But Instagram has a slightly younger demographic. There've been studies that look at this, and it's kind of the preteen to like, the 30s. So for facial plastic surgery, that kind of, it's a lot of like the injectable practice and the,
yeah.
rhinoplasties. And then Facebook, which I added once I had, once I started developing my website, and that's a slightly older patient demographic. So that's like mid 20s and up. And if you think about it, I think my parents know how to use Facebook, but
Right.
not really Instagram. So,
Right.
that kind of opens up different, procedures, potentially.
Mm,
I think I do have a Twitter account. I don't manage that one. My website company takes care of that one, and also Facebook as well. But Instagram, I tend to do that on my own.
mhm. Is it time consuming or is it part of just like your routine day or a week now where if it's something that's unique, you know what you want to post and it's just click, click, click and it's out there?
Uh, it's like everything. I mean, you get better the more you do it,
Yeah.
but it is time consuming. And I kind of, if I have certain photos I want to include, I'll save them, and then I'll post them at certain times or spread them out throughout the week. But I mean, it does take time to kind of pick the picture, put the little blurb that you want. I think the hardest part is trying to develop or how you want to present yourself on social media.
Right.
Some
Explain
people
explain that. Yeah.
like to have try to create these funny posts and kind of witty or whatnot, and some people keep it very professional. I tend to keep my work one very professional. So there's mostly stuff about me at work and, patient before and afters. And, I don't include a lot of like, family and my personal
Right.
stuff. Now, there are studies that look at that and say that, that the actual photos that get the most likes are before and afters. The photos that get the most followers are actually your personal photos when you
Oh,
start to
okay.
share about yourself.
Hmm.
Um,
That's interesting.
So, I tend to do the personal stuff through like the stories on Instagram, and I keep the actual post about work. But I think, a lot of practices, hire someone to do their Instagram. And I think it's obvious when it's someone else running the Instagram.
Right.
So I think that your, kind of personality and your vision of the practice comes through.
Yeah.
So that's why I maintain control over my Instagram.
Yeah. No, I hear what you're saying. I mean, patients, I think, want to get to know you beyond the surgeon persona. Do you like this person? You know what I mean? Like, do
Yeah, and
they,
you have to be careful about like, if something is, really funny that you would laugh at,
yeah,
someone else may say, well, that's not so funny
it's
if you're in the
offensive.
operating
Yeah.
room doing it.
Right.
So,
So, what are things? So, in terms of, again, just taking it back to trainees for a second, these conversations in terms of social media and sort of appropriateness, or I guess, how do you balance what's appropriate for social media and then how to utilize it to your advantage for your practice? How do you sort of balance that? And how do you advise trainees to be able to distinguish between the two?
that's actually a really good question. I mean, obviously there's no one's governing Instagram, and you can, post whatever you want. Actually, no one's governing any of these things. I mean, you can put on whatever you want and say you're, the world expert of whatever, but it's, you have kind of ethical obligations. So as far as like trying to guide someone and tell them how to do it, I just say, I mean, honestly, you just be honest and ethical.
Yeah.
When you're posting photos and I mean, that there's, HIPAA with, anything medical related
Yeah.
is very, very serious. And so I know a lot of people who post photos in the operating room. You have to be very, very careful
Yeah.
about that. There can't be anything that's identifying to the patient. It could be, if you take a photo of the OR and all of a sudden there's a name, 10 feet behind you, then that's a violation as well. So, and obviously if there's anything that's, potentially identifying to a patient, you need, consents and all that sort of thing. So I don't post anything without a full written consent from any of my patients. That's in the OR, in clinic, anything.
And when on your consent, do you have to specifically put this could potentially be used for, the website, for Instagram, for Facebook, or is there like a general for any social media? Do you have to kind of specify that kind of stuff on the photo consent?
My initial photo consent kind of outlined all, everything separately.
Hmm.
And then the university, redid it with their attorneys and they lumped it all together. So it's kind of just one checkbox. But I always
Yeah.
tell patients that, you can specify how your photo is used. If you want, you know, zoomed in so it's only your nose, or, we can use everything. So, I give them that option.
Yeah. Are there things that you were kind of worried about or thought could become an issue with social media for the practice that you actually found that, hey, the patients don't, there's certain things that that aren't that big of a deal, maybe from the other end of it? Or like, do you
Uh,
find that your patients are pretty relaxed because it's such a common,
the younger patients like ask to be on it, honestly,
okay.
because they like follow. Because all patients now they Google and they look up who you are, and
Right.
that's some patients are like, oh, am I going to be on your Instagram or whatnot? And so like, so I talk to them about that. Older patients are not going to, they don't know, or they don't know who looks at it. So kind of the pros and cons of it. I would say, I mean, obviously it takes a while to kind of grow Instagram and actually any of the social media things. The pros are, I think it gives you kind of instant credibility when you start
Yeah.
up, because, someone looks at your profile, and if you have 200 followers versus 2,000 versus 20,000, that immediately, paints a different picture
Yeah.
in a potential patient's mind. I think now I'm actually starting to generate patients through Instagram, which is something that I never thought would actually like
Yeah.
happen.
Yeah.
Um,
So meaning other people see other people's pictures on your Instagram and then they come to you? Is that kinda how it would work?
yeah, they'll say, "Oh, we found you on Instagram. We liked one of your photos. Then we
Got it.
went to your website." I will say, any of these social media outlets, it points back to a website.
Okay.
So if you don't have a website, none of these, then you lose these potential patients like in cyberspace, because they don't know where to go.
Okay.
So they have to be able to get from the social
So they
media
can find
page,
you.
yeah, to whatever, page that has your address, your phone number, and how to get to your office. I don't think your website has to be, something fancy and that sort of thing, but it needs to be an informational site to like, that way they can, reach out to you.
Okay.
And I don't encourage, or I discourage patients from trying to communicate with me through any of the social media outlets.
Yeah.
Oh, but so then the negatives of social media is, the more visible you are, the more you kind of open yourself up to criticism.
Yeah.
And so that's kind of the big thing
So do you
is,
like, so comments that people put on the the Instagram or the, Facebook, just comments of their opinions of whatever you've posted?
so comments you have to watch out for. Any type of negative comments, I make sure I take those down right away. I
Yeah.
don't think that there's, any place for that. But, the more visible you are online, it's the more people will, look at your reviews, write a
Right.
review, so you
Right.
kind of open yourself up more.
Yeah. Yeah.
So it's,
Um
pluses and minuses.
Yeah. And then in terms of the website, is that something that you were able to do on your own? Do you have to hire somebody? Are there special firms out there that do websites for physicians?
Yeah, so there's quite a few companies that, design them specifically for, I mean, you could probably find a company that's familiar with any subspecialty of medicine. So the company that I use, has designed several of my friends, and they write all the content. It's written in a certain way that it triggers Google Words and all that sort of
Mm,
thing. But designing a website's, a whole nother discussion, and
right.
I'm not an expert at that for
Right.
any by any
Yeah.
means.
So in terms of other, we talked a lot about social media as a part of practice building. Do you think there's still a role for other, I guess, more quote traditional ways of, going out and meeting doctors or giving talks to community physicians? I don't know how relevant it is maybe in plastics per se, but do you feel like, that sort of one to one personal, here's my cell number, call me, and you've met them in their clinic. Do you feel like there's a role for that?
Yeah, I do, and I spent a fair amount of time driving by different physician offices. I would say the one thing that I came across when I started to do it is when you're affiliated with a university. Obviously, your referral sources are within the university,
Yeah,
and so that's kind of the obvious physicians that you should reach out to first. Then trying to get someone from outside the university to refer in, you have to reassure them that you're
they
not going to
won't.
steal you're
Yeah,
not going to steal their patients, that you're going to treat them for what they referred that patient to you for, and then you'll send them back. So they need to have that trust. Otherwise, those outside relationships get kind of hard.
yeah.
Um,
No, I agree with you completely. I think that going out, meeting other, whether it's general ENTs or other ENTs, private practice that might refer to you, tertiary care stuff is important. Those relationships are very important. And for me, for peds, I met a bunch of community pediatricians as well. Like, here's my cell number, call me anytime. It's hard for that group. They just want to make sure that their patient doesn't get lost in the system, that, there is
right.
follow up, that there is, somebody is there that's going to, because I feel like the fear is the academic center is this big fortress and it's just hard to navigate and get through. And
Yeah.
so are you
Yeah.
going to be there to help get them going? And I like you said, the people that are already in your network or in your university, that's a little bit easier, and I agree, it's very important to get to know those docs as well, because when you need something for your patients, a consult for whatever it is, they're there for you, but breaking into the community, depending on the referral patterns, can be very difficult.
Yeah, and I don't know what your institution does, but when I first joined, they kind of send out a flyer to everyone to kind of alert everyone that you're there and
Yeah.
try to boost your business. But honestly, it's like the face-to-face like
Mhm.
introductions that really make a difference.
Yeah. So we had like a recruiter who I went out with 2 or 3 times over a year. We went to different, for the community pediatricians, for me, we went to the different practices, and there's still a handful that will refer me patients, which is nice. And in terms of academics, I have an awesome boss, if you will. My division chief is wonderful, but he also positioned me with unique opportunities to give talks, like, okay, you're going to give a talk on, pediatric sinusitis to the pulmonologist, or, sleep apnea from the ENT perspective, so that some of the other divisions kind of get to know you as well.
Oh yeah, that's great. Yeah, any type of anything where you can kind of showcase your knowledge is a
Yeah.
huge plus.
Yeah, for sure. What other things? I mean, in terms of practice building, I feel like, there's social media, there's a traditional face-to-face meet and greets, there's community lectures, and the opportunity to be able to, give an update on whatever the new practice guideline is, or to the ER doc on how to evaluate and manage a nasal bone fracture. All those kinds of
Hmm.
things are important. What else have you found, or do you feel like you use to build your practice?
I mean, I don't do any like printed ads. I don't know if, it is popular here in Utah, but that's not something that,
Like in the
uh,
local community newspaper?
yeah, newspapers and magazines and that sort of thing.
Mhm.
I just haven't done much of that. Although I do think there's probably a place for it, but I think you get more bang for your buck on, social media.
Yeah.
I mean, honestly, social media is free. It's just,
Right.
it's just time.
Yeah,
And
and in a shorter period of time, you're reaching hundreds potentially.
actually, I should probably mention that. That is probably the number one reason why I started with Instagram. So I was like, it's
Yeah.
free, as long as I devote the time, it should, hopefully grow into something.
Yeah. I'm super curious about, being the doctor to some of the sports teams, kind of how that fits into your practice and how that helps you build your practice as well.
Oh, so it's really an affiliation that the university has with all the
Yeah.
organizations. And being that I'm the only facial plastic surgeon at the university, I reached out and I'm on kind of this short list of physicians that take care of
Wow.
these patients. I wouldn't say we get like a ton of patients and that kind of comes in waves,
Yeah.
when, athletes are gearing up for the Olympics, you'll occasionally see one or two here and there, depending on what's going on. But I wouldn't say it's like a huge, part of my practice or a, huge advertising thing that I do.
Yeah. So I guess when they need
Um,
you.
yeah.
Yeah.
And they call you and you have to be available at any time, which
Right.
is,
Yeah.
um,
Convenient.
what I was gonna say, one thing that you mentioned about how outside physicians don't want their patients to be lost within the system. So I'd say one of the most important roles, or part of the practice that's really helped me, is having a an administrative assistant, which I guess is kind of the academic title, but in a private practice world, it's like an office manager.
Yeah.
That kind of oversees everything and can, is kind of the point person for, all contact within the practice and can help, guide people and
Yeah.
referrals. And that's something that I wouldn't have thought of, but my fellowship director said that that's, really important. And I'm, glad that I pushed to have that.
Yeah,
I,
no,
I,
I agree with you completely. You need that one person where you can forward that email and say, "Hey, I need to see this patient this week," and boom, it's done. It's taken care of.
Yeah, and for facial plastic surgery, I don't know if it's just, having plastic surgery in the title or whatnot, but patients, like there's an increase in demand from patients. So you
Yeah.
have to be, ready to take that on.
You're like, "It's not this week,
So
it's this afternoon."
yeah,
There's a little
exactly.
bit more
Yeah.
urgency to it.
Yeah. Everything is slightly more urgent.
Yeah. So you talk about your administrative assistant. What other clinical support or other types of administrative support do you feel is important, has been important for your practice?
So my practice I keep really small because I think the more hands you have in the pot, the more potential for errors and miscommunication. So my entire office is just two MAs, that administrative assistant that I mentioned, and a scheduler.
Oh,
So
wow.
and that's it. I have one person who's kind of dedicated to the oversee the practice as far as billing, because when you start to do, it's not so much whether it's purely insurance based or purely cosmetic. That's not where the mistakes happen. But when you're running part of it through insurance and part of it out of
Yeah.
pocket, that's where things can get kind of jumbled up in the billing of a
Right.
big academic center. Another thing is I have a dedicated scrub nurse. And so I operate and do clinic at two different locations. And so my
Yeah.
whole team kind of moves with me between the two
Oh, that's
locations.
awesome. Yeah.
So honestly, it's like a dream setup.
Yeah, that's amazing. That's your dream team right there, and then they can go with you. That's huge.
Yeah. But I would say starting out, you know, I used to see all the patients. I would see, all the consults, all the follow-ups,
Yeah.
I would do all the suture removals. And, I think building a practice, it's all that, kind of hands-on face-to-face
Yeah.
contact
Yeah.
that, really helps develop the practice. And now I'm, you know, busy and I need, to offload some of that stuff. And so
Right.
the MAs do some of the suture removal, but I think kind of the early on, them seeing how I interact with the patients and my instructions on, what I tell them at 1 week, at one
Mhm.
month, at 3 months, at 6 months, they've heard it, 1,000
Yeah.
times, so that they're, comfortable dealing with it. And, I always tell them, text me about anything, I'd rather know too much than too little.
Right.
And so we have our own text chain with the office, and we're always in contact with each other.
Yeah. That availability to your staff is very important because that's what's gonna keep that availability to your patients. You touched a little bit on COVID and how you've actually seen a jump in the patient volume. In terms of day-to-day practice management, has COVID how has it changed the day-to-day stuff, I guess?
Yeah, so we shut down, I think, for 6 weeks. It was like no elective surgeries, which is honestly like the vast majority of what I do.
Yeah.
I did do some facial fractures, that sort of thing during that shutdown. So when we opened, we were wearing N95 masks all the time, and it was only, the surgeries and, consults and, follow-ups we would do virtual. And I used to scope patients in the office. I stopped doing anything that was potentially aerosolizing.
Yeah.
So it's really just kind of face to face and kind of a quick exam, and then the follow-ups were virtual. I did do the virtual consults. I think helped. It was kind of like a band-aid while we were kind of closed down.
Yeah.
I don't. Yeah, I mean, I think in some specialties it does help. I think in facial plastic surgery, it's really hard
Yeah.
because that physical exam is kind of, can you operate and can you fix this? The answer is
Yeah.
like yes or no. There's no like real medical management unless it's like wound care stuff.
Yeah.
So, there wasn't a great conversion between consult and surgery with virtual consults.
Yeah.
And I don't think patients took the consults quite as seriously. So, when we had a bunch of like emergency privileges where we could, practice across state lines and all that kind of stuff with all the neighboring states, and we kind of stopped doing the virtual consults because of that. So we do all in person now, and so I still test everyone for COVID going to the OR.
Mm.
I don't do any aerosolizing generating procedures or scopes or anything in the clinic. So I can wear a regular mask in clinic and eye protection, which is what my staff does.
Mm.
And then, everything is essentially back to in person. And I do, follow-ups in person as well. The, as once the COVID shut down and kind of the reopening happened, the guidelines were kind of all over the place. Some
Yeah.
institutions were super cautious and some, were really delayed in in what they were doing. I think we talked before,
Yeah.
Stanford kind of early on published like
Yeah.
what they were doing, and I kind of used that as a guideline, and they
I
were,
did
very
too.
cautious.
Yeah, for
So I,
sure.
so I think my practices, restrictions and guidelines were, um, were much stricter than the University of Utah in general was doing, and
Yeah.
I still think we are. But again, my practice is very elective, so I don't, I don't think it's worth putting anyone at risk, whether it's a patient or staff or anything
Right.
like that. So I kind of err on the side of caution.
Yeah. No, I think that is smart and very reasonable. And I agree, the Stanford guidelines from that were circulating by Zara Patel were super helpful and definitely helped me in multiple situations, especially in those first few weeks before the academy had guidelines out. I give her a lot of credit for taking the, initiative and voicing, hey, this is a real issue and, we need to think about protecting ourselves because if we aren't, nobody else is going to be doing that for us.
Yeah, I
So
thank her for putting that together and circulating it, quickly.
for sure. I mean, I don't I there's most I feel like there's so many people who got it, and I got it not just and I remember receiving it from multiple different sources. And so I thought that was very, very helpful because it at least gave me some guidance and communication in a time of kind of panic, of just uncertainty and hearing certain, maybe demands on one end or expectations on one end, yet what's realistic and what's appropriate on the other.
Yeah, I
So,
found that a lot of the other guidelines, all the journals tried to like quickly put out articles but they were, delayed by several weeks and the,
yeah,
information was changing on a day-to-day basis.
yeah. And what was it? Social media that got
Yeah.
some of these, that at least got the communication and some of the stuff out, when
Yeah.
it was needed. You touched a little bit on, virtual consults and, maybe not necessarily being I guess my question is there a role at all for certain virtual visits, in your practice, in a facial plastics practice potentially, or do you feel like if the preference is gonna be in person as much as you and the patient is able to do it?
I think most of it's in person. I think, virtual visits you can do if it's, like a cosmetic consult where it's like facial rejuvenation and you're kind of, looking at a patient and giving them, your recommendations. Nasal consults are extremely difficult because you can't really evaluate the inside of the nose or any type of function. I do think that there's a role, say, in like facial paralysis patients where you're looking to see, you want to see how well the face moves. And
Yeah.
that's, so I do think that that helps. Some follow-ups, I think the initial follow-up after, surgery, I don't use a lot of dissolvable sutures, but even if I did, I'd want to see the patient back to make sure that the incisions are healing well. There's not a lot of, if someone has like a facial fracture, I can look at a scan and say yes or no, it needs to be repaired or not,
Yeah.
and then I can see them right before surgery. So I don't think facial plastic surgery, the role of virtual visits is as beneficial as, say, other fields like rhinology, where you kind of go over CAT scans and discuss it with patients, and there's medical management.
Yeah.
So I don't know. I mean, I
But I
like I s-
agree with you because even when you're like you said, you can't look in the nose. You can't look in
yeah.
an ear. You can't always look even when, to have them show me the back of the throat, that lighting has gotta be whatever, otherwise it looks dark.
And
Anything
then you
that
always have connection problems.
yeah. Oh gosh, yes.
I mean, there's
Yes.
always technical problems. And so devote all this time to it. And then at the end, you're like, well, I need to see you in person. So, like, you know, and I don't know what the hospital guidelines are, but I don't think it's appropriate to double bill a patient.
Oh, yeah.
So,
No. Yeah, no, for
s-
sure. I've had to
so
convert many virtuals onto just telephones. Like, "Let me just call
yeah.
you."
And I don't know what platform you guys use. I mean, we had, it was all done through, but they want us to do it through Epic or MyChart, I think
Yeah.
is what they have now. But, before we were doing, FaceTime and Zoom and,
Yeah.
um, it's kind
Ours,
of
they have like a
Doximity came out with one.
yes, I think Doximity's is actually supposed to be pretty good. They have one on the adult side here called Blue Jean, I think, and then the one that we use at Children's is called, like, American Well Clinician, which is hit or miss. I'd say about it works about 60-70% of the time, but then there's still, that 20-30% chance that it may just
Yeah.
disconnect or freeze or glitch or something.
I
So,
mean, I think FaceTime works the best, but I don't know if that's like, up to privacy standards.
yeah.
Probably. I mean, it's not, as far as, for billing purposes.
Yeah. Well, Eric, do you have anything else, any other pearls or pitfalls or anything else you want to leave our audience with in terms of practice building today?
I mean, I think the pearl is just to, work hard, do good work, get good results, and the rest kind of follows, and you have to be flexible. I think that
Yeah.
COVID has, challenged a lot of us with adjusting our practices and different patient demographics and different surgeries and that sort of thing. And you just have to be flexible it's another challenge that we face.
Yeah, for sure. And I think what you hit the nail on the head. You just have to work hard.
Yeah.
Yeah, I mean, at the end of the day, it's elbow grease, sleeves up, true
Yeah.
grit, and do the right thing, and the
And,
practice will
and
build.
I mean, there's no trick to it. Even, people who take shortcuts and you buy a bunch of Instagram followers, it's obvious,
Yeah,
who those people are. So
yeah.
you just do good work and it'll slowly grow.
It will. I hear you. Thank you so much for taking the time to talk to me today. I learned a ton, especially about practice building. I enjoyed a lot of the conversation on the COVID stuff as well. So I really appreciate your time, Eric.
Yeah. Thank you for having me. Hopefully it was beneficial.
Yeah. If
Are you,
people
are
want to
you,
find you, do you want to tell us what your how they can find you?
yeah.
Social media
So
connections?
social media on Instagram is just at Dr. Cerrati. So Cerrati. My website is just www.drericcerrati.com. All the links from there. Are you going to
Okay.
go create an Instagram page now?
Well,
Profile?
no, no. I have no Instagram. This is my first coming out from under my social media, like, rock. Like, I didn't have anything until we started doing our BackTable ENT podcast. So, that's why some of the lingo I'm like, what do they do when they like, what do you do?" But for our listeners who are interested in finding out about more of us at BackTable ENT, the Twitter handle is underscore BackTable ENT. And before we leave today, I just wanted to take a moment to think about Ruth Bader Ginsburg and all that she contributed. I was super sad, obviously, with the rest of the world at her loss on Friday. She was Obviously, one of the biggest warriors, icons for gender equality, really a true civil rights hero. And so a major loss, but somebody who will remember. But anyways, tune in. Going forward, we'll probably be doing 1 to 2 shows a month. You feel free to email me at gopi@backtable.com for any suggestions, questions. If you want to come on the show, topics, we're here. Take care. And that's a wrap.